Understanding and managing the symptoms of Raynaud syndrome. Raynaud syndrome, also known as Raynaud's phenomenon or disease, is a condition that affects blood flow to the fingers and toes. It causes the blood vessels in these areas to narrow, reducing blood flow and causing the affected areas to turn white or blue. The condition can also cause tingling, numbness, and pain in the affected areas. There are two types of Raynaud syndrome, primary and secondary. Primary Raynaud syndrome is the most common form of the condition and is not caused by any underlying medical condition. Secondary Raynaud syndrome is caused by an underlying medical condition, such as lupus, rheumatoid arthritis, or scleroderma. The exact cause of primary Raynaud syndrome is not known, but it is thought to be related to a problem with the blood vessels in the affected areas. The blood vessels are more sensitive to changes in temperature and can constrict more easily than normal. This can be triggered by cold temperatures, stress, or certain medications. Secondary Raynaud syndrome is caused by an underlying medical condition that affects the blood vessels. This can include conditions such as lupus, rheumatoid arthritis, and scleroderma. Symptoms of Raynaud syndrome typically include the fingers and toes turning white or blue in response to cold temperatures or stress. This is followed by a tingling, numbness, and pain in the affected areas. In some cases, the fingers and toes may also turn red and swollen after the blood vessels have constricted and then dilated again. The diagnosis of Raynaud syndrome is typically made based on the patient's symptoms and a physical examination. A test called a nail-fold capillaroscopy may be used to examine the blood vessels in the fingers and toes. In some cases, additional tests may be performed to rule out other conditions. Treatment for Raynaud syndrome typically involves avoiding triggers that cause the blood vessels to constrict. This can include avoiding cold temperatures, reducing stress, and avoiding certain medications. In some cases, medications may be prescribed to help improve blood flow to the affected areas. Raynaud syndrome is a chronic condition that can cause significant discomfort and pain. Treatment can help manage symptoms and improve quality of life. It's also important to seek medical attention if you notice any signs of secondary Raynaud syndrome, such as sores or ulcers on the fingers or toes, as this may indicate an underlying medical condition that requires treatment. In summary, Raynaud syndrome is a condition that affects the blood flow to the fingers and toes, causing them to turn white or blue in response to cold temperatures or stress. It can be caused by an underlying medical condition or by primary Raynaud syndrome, which is not caused by any underlying medical condition. Symptoms include tingling, numbness, and pain in the affected areas. Treatment options include avoiding triggers and medications that can help improve blood flow. It's important to seek medical attention if you notice any signs of secondary Raynaud syndrome, such as sores or ulcers on the fingers or toes.